we will scan the gallbladder and biliary tract. About the biliary tract. The place to look is the common bile duct. In other words, you can think of CBD as. Now, the first is a right subcostal scan. There are several methods. The right subcostal scan involves digging under the right rib and holding the probe. When the liver was examined, it was scanned this way now, focusing on portal vein, but slowly pulling the probe down like this. Under the ribs, as now, at 7 o'clock. Putting it under the ribs. When the direction of the probe is tilted toward the right shoulder side of the head like this, a picture like this will appear. At this time, the portal vein branch is visible. Don't you see the IVC here? At this time, stand upright like this at the right portal branches. On this straight line, it will look like a hyperechoic, long line with high shades of shades. To say that these line shades are called main lobar fissure. It's main lobar fissure. This main lobar fissure. If you straighten the extension on an arbitrary line, it will be like this. In this case, it is connected to the IVC, and the line connected to this IVC is our Cantry's line. Speaks. So around Cantry's line. This is the right lobe. This is the left lobe. So how do you find the gallbladder? Where this Cantry's line is visible. Just turn the angle of the probe a little more to the 6 o'clock position. When turned like this, the gallbladder looks like this. So Cantry's line is the most important landmark to depict the gallbladder. Can you think like this? So here you can see the anatomy where this is the fundus and this is the neck portion. Let's practice based on the theory of right subcostal scan. Let's do a right subcostal scan. Right subcostal scan. Now, let's start with the probe as the center. Scan in this way from the transverse scan to the position where the portal vein is visible. And then down the portal vein. With a slight twist, a bright line echogenic structure is observed here. This bright line echogenic structure will be the main lobar fissure. If you take this as the center of this main lobar fissure and continue to extend it, you can see the IVC here. If you are going to draw a straight line towards this IVC, this line is the Cantry's line. You can see it like this. Centering on this Cantry's line, this can be divided into right lobe and this left lobe. This isn't important. From a position where the main lobar fissure is visible, orient the probe slightly downwards. If you turn it a little to the 7 o'clock position, you can tell that the gallbladder comes out right there. So when the main lobar fissure starts to show, move the probe in a slightly downward direction. If you rotate it a little like this, you will be able to observe the appearance of the gallbladder. The gallbladder is visible. This is fundus, and this is the neck portion. Because the gallbladder is located very close to the abdominal wall, if you use a probe with a higher frequency, you can see it a little better.